Like I said, we've got an awesome speaker coming up next. He is a visionary leader driving the adoption of cutting-edge practices in California state government. As the director of the Office of Data and Innovation, he leads efforts to embed product management principles into government operations, ensuring Californians receive exceptional service experiences. With a focus on user engagement, adaptability, and iterative success, he is spearheading a transformative approach to safely and effectively adopting emerging technologies like generative AI. Here to share insights on harnessing technology with a product mindset, please welcome ODI Director Jeffery Marino.
Thank you, Adam. That was about me? You were talking about me? We're definitely all doing that together. Good afternoon, everyone. It's very humbling and a great honor to be on this stage, to share the stage with the incredible panelists that we've had today. And I was going to tell a story about COVID. I noticed that there were very few COVID stories today, so I'm glad I decided against that. I think the COVID stories may have. Thanks for the laughs, guys. Yeah, I'll bring those back one day. But today, I want to talk about everyone in this room's favorite topic, a spectacularly failed IT project. I'm going to talk about healthcare.gov. And so I know that you all probably know how this story ends, and I'll also come to a point about generative AI and product management eventually, but I think it's a really good example that sets the stage and the context for the discussion that we're having today. So in 2010, the Affordable Care Act had just passed, and healthcare.gov was meant to be the gateway for millions of Americans to access their health insurance. It wasn't just a website, it was the foundation of a law that promised to revolutionize healthcare across the country. Expectations were extraordinarily high. The stakes couldn't have been higher, both for individuals and their families, but also for the reputation and trust of the government. So in 2010, just after the act passed, teams went to work on building this site. I did some research on this. ChatGPT helped quite a bit with me, and it was about a 1,000-page RFP at that time with a $100 million budget. It quickly ballooned into $200 million, and then some estimates after the fact put it closer to $1 billion by the time it was all said and done, which is just staggering. So then in 2013, after more than 2 years of development, the government was ready to launch. Contractors reassured agencies that the system would work. Politicians touted its incredible potential. And it launched on October 1st. October 1st was the deadline set in legislation for all of the exchanges to go live. And so it's a really important point, I think, when we realize that this particular project, this particular example, was driven by a policy and political deadline. And it, in fact, went live on October 1st while the whole world was watching. The site launched, and then it crashed. And then it crashed again and again and again. And when it was kind of working, the experience was terrible. People were having trouble logging in. People couldn't understand the process that they had to go through. And it was just obviously a bloodbath in the media. And millions of Americans were met with frustration instead of access. The media called it a disaster, and public confidence in the Affordable Care Act and even in our government was shaken. This was a website that millions depended on, and it was barely functional in the year 2013 in the richest nation in the world. So here's what happened next. A crisis team was brought in, a mix of government leaders and private sector experts. They worked around the clock diagnosing issues, interviewing users, fixing both the fundamental flaws in the technology and the site, as well as putting into place a new method of operating moving forward to ensure that this did not happen again. By December 2013, healthcare.gov, just a few months later, was fully operational. It wasn't perfect, but it was working. And millions of Americans were able to enroll in the health insurance that they were entitled to. And so I also want to note this example, and it really only dawned on me this morning as I was listening to all of the great panelists, how closely tied this example is. By the way, this crisis team that was brought in is what led to the creation of the US Digital Service, and then eventually 18F, and I would include places like the Office of Data and Innovation in that trend. And that trend emerged out of the healthcare space. And think of how many incredible leaders on this stage are from the healthcare space. Our previous Secretary of Health and Human Services, our AIO from Health and Human Services currently, even our state CIO was talking about a health-related issue this morning. And so it's really in those instances where the pain is felt when we have a public service failure. So the takeaway here, though, is that the failure was not necessarily in the technology of healthcare.gov, it was in the execution. And so what went wrong? Why did they stumble so badly? First and foremost, I would go back to that deadline that they were driving towards and think about the fact that 2 years were spent, 2.5 years were spent driving towards a deadline, and that done was success. The user experience was an afterthought. The site wasn't designed for Americans to use. It was designed to fulfill a requirement. The result that it was confusing, clunky, hard to navigate, and instead of helping Americans navigate an incredibly complex system like our healthcare system, it mirrored those complexities. It was rushed to meet a political deadline, and it was built in silos and fragmentation. There was over 50 contractors involved, over 50 contracts involved in the creation of the site. There was no unified oversight that could actually drive a singular vision of success and a desired outcome. So as I said, it was out of this experience that the US Digital Service was born. And since then, teams like ours at ODI, CDT, all of the incredible vendors and innovators in the room today have been working to introduce new tools and methods to ensure that users are involved early and often, and that project development happens iteratively and with a product management approach. Failures like healthcare.gov can be avoided with a product management mindset. And this is where I come to the topic at hand today, which is, I would say, the importance, not just the importance, but the critical nature of adopting a product management approach when it comes to adopting an emerging technology like Gen AI. I hope that I don't sound too naive when I say this, and history will prove how accurate I am, but I firmly and personally believe that Gen AI brings incredible transformational potential to how we deliver services in government. It's not just because of what the tool can do, but how the tool demands that we use it. So let's start with how we can use the tool to solve some of these challenges. And we've gone over some of them today, but we know that Gen AI is incredible at simplifying complex processes. Going back to healthcare.gov, imagine if there were an AI assistant that was helping someone through the process rather than a screen that demanded you follow the poor design that was sitting in front of you. Another incredible opportunity that it provides is with digital twins. When we are looking at launching a large-scale tool, we are able to simulate that launch, find out what the potential pitfalls may be, and do so in a virtual production environment. This is a huge win for getting around a systemic issue that we have in government where it's hard to launch, right? There's a lot of reasons for the risk aversion that we have in government when it comes to product development. And one of the core principles of product thinking is that we launch early, that we have iterative and incremental success, and that's something that there are just too many barriers in the way as it stands right now for us to adopt as a way of doing business in government. So GenAI offers this limitless potential, but its success depends much less on what it can do, and almost everything depends on how we use it. To make GenAI work in government, we need to do so with this product management approach. People have been advocating for a product mindset in government since at least 2013, so this isn't news. But the particular benefits of GenAI, as well as the unique risks, demand that we take this approach. Otherwise, we run the risk of the next healthcare.gov happening and potentially with even more dire consequences. So at ODI, our roadmap for implementing this approach is to always start with the user, people first. We have to ask, what problem are we solving? And most importantly, how is this going to improve the lives of the people we serve? Next, we have to build cross-functional teams. We're doing this right now with the GenAI proof of concept teams. And I can tell you from personal experience that it hasn't been easy. It's a foreign concept. But when we've worked with these teams and said, we need you to provide a product lead, the team said, what the hell does that mean? And so it was a great opportunity for a great educational opportunity. But once we went through a mini training on what that meant, the division chiefs, the branch chiefs, the deputy directors over certain lines of business immediately saw themselves in that role, because that is what a great product manager does. They understand the business value and can keep track of whether or not it's delivering that value, and then be flexible and iterate when it's not. Again, this goes back to what our panelists were saying earlier today about business needing to be in the room. Iterate relentlessly, don't wait for perfection. Again, the healthcare.gov scenario shows what waiting for perfection looks like. Waiting for perfection looks like disaster. And nothing will ever be perfect, which is what quick release and testing, that's the great benefit that it provides. I came up with this morning, and I'm pretty proud of it. Would you rather fall off of Niagara Falls or fall into the Sacramento River? So it would really suck to fall into the Sacramento River, but it wouldn't be as disastrous, right? And that's what happens when we can take these smaller steps. You still might fail, but those failures are incremental and can be absorbed. We need to measure outcomes and not outputs. Success isn't the number of applications that we've processed. That can be a great KPI because maybe there's a denominator that we need to hit, but it's whether or not you've actually successfully enrolled someone and they're benefiting from that service. And finally, invest in talent first and tools second. We have to build the infrastructure that supports that innovation, attract and train the best people to lead this transformation. So generative AI creates a conversational model of product design and development. It learns from how people interact with it. It evolves based on real-time feedback, and you cannot just set it and forget it. This is why we must iterate continuously, because what works today with these tools may not work tomorrow. This is why we must focus on the user, because with GenAI, every interaction shapes the next experience. And human-centered design is the skill that all leaders must have going forward in this new paradigm. And we have to stay agile, because the true power of generative AI lies in its ability to continuously adapt, and we have to be able to adapt with it. So, of course, there are plenty of barriers to taking a product management approach to our work. I forget who said it earlier today, but if it were easy to do, we would be doing business this way already. And we're all aware of many of these barriers. We're on an annual budget cycle. It almost demands that we take a waterfall approach, the 18-month budget cycle. We just heard from the panel earlier about workforce development and how difficult it is to do recruitment and retention in government. Our vendor partners are on contracts that have start and end dates. So as much innovation that you may bring, and as much as we know that you would like a contract that never ends, that partnership at some point needs to lead to knowledge transfer and change management. And in this new paradigm, maintenance and operations is replaced by continuous improvement. So that's really the message that I have for the audience today, is not that this new way of operating is coming, but that it is already here. And earlier, Shani mentioned that it's everywhere now. That's definitely, I'm going to talk to you later about that. That's not true. We're working really hard on getting it everywhere, but by and large, it is a foreign concept that is very difficult to adapt in government, and we still have training wheels, but they're on, and things are moving forward. To that point, as it relates to the RFI squared that are being deployed in the generative AI proofs of concept, we have working prototypes of an emerging technology within 6 months in government. That is absolutely incredible. And I think the secretary noted earlier this morning that they're using publicly available data. Those use cases are still conceptual, they're proofs of concept, and they're not in production. So we don't know what's gonna happen next. We're all talking about that right now, very seriously, because we don't wanna lose that momentum. But the point is, the concepts have been proven. They've been proven safely. They've been proven to deliver value. And that provides so many benefits in terms of being able to make a case to the Department of Finance or make a case to the legislature. When you have, again, as the secretary said, sorry, she's my boss, so I hear her in my head all the time, people will believe it when they see it, right? And that's what I think drives so much of our method of delivery in government. So we are eager to deliver, and we are eager to deliver something perfect that works for Californians the first time, every time. And again, to echo the panel this morning, that has not proven to work. So, again, my message is that challenge-based procurements, RFI squared, taking a product management approach, a modular approach to procurement, modular contracts, shorter-term contracts that may lead to a long-term partnership are really the wave of the future. So generative AI isn't just a tool, it's a catalyst for the transformation in government service delivery that we've been chasing for over a decade now. And in order to use this tool for good, we have to embrace a new way of working that means putting the customer first, prioritizing building the cross-functional teams and collaborative teamwork, and ultimately acknowledging that this moment of transformation demands that we champion incremental success over big bang releases, and that we have the grace and the risk tolerance to have those hopefully incremental failures along the way as well. That's all I got for you. Thank you very much.